And a warm welcome to our final University of Southampton public lecture of the 2018 series. Our focus this year has been on population and migration, and tonight's lecture will discuss population mapping in low and middle income countries, an innovative way to support the Sustainable Development Goals. So my name's Rachel Mills, and I'm the Dean of the Faculty of Environmental and Life Sciences at the University of Southampton, and I'm going to be introducing the speakers tonight. And then we're going to have a panel discussion after the three talks. Around the world, millions of vulnerable people are unable to access the most basic of human rights because, according to official records, they don't exist. This leaves governments unable to adequately respond to emergencies or plan for the future, and our researchers in the World Pop programme at the University of Southampton are revolutionising population mapping and accounting for these unknown communities for the first time. As a result, aid can be supplied during natural disasters, more people can vote in elections, and vaccination programs can be mobilized. At Southampton, we have a unique combination of strengths in demography, geography, and computer science, combined with unrivaled expertise in integrating data from sources such as satellite data, census data, and survey data. We are one of the first organizations that UN agencies and governments turn to in the event of a natural disaster to assess numbers of people affected and to ensure aid is delivered to those who need it. So in this session, our experts will discuss the latest techniques, the challenges surrounding population mapping, including integrating data from sources such as satellite imagery and mobile phones, and carrying out small area surveys to estimate population numbers and distributions. Tonight, we'll hear from our three expert speakers who will each deliver a keynote, and then this, as I said, is going to be followed by the panel discussion. So our keynote speakers are Professor Rachel Snow from the United Nations Population Fund, Professor Andy Tatum, and Dr. Chigozie Edson Utazi from the University of Southampton. So please join me in welcoming our first keynote speaker, Professor Rachel Snow, who will deliver her keynote, Mapping Vulnerability, Enabling Change. So I've got a few things to say about Rachel. Rachel is the Branch Chief of Population and Development in the Technical Division of the UNFPA. She leads the fund's work on strengthening national population data systems and the greater use of demographic intelligence in development. With more than 25 years' experience conducting research on the burden of reproductive health, health system capacity and quality, and the structural obstacles to universal access to reproductive health care, Rachel is a committed advocate for improving population data and research capacity, particularly amongst women scientists. Welcome, Professor Snow.
Thank you. So good evening, everyone. It's a pleasure to be here, and especially a thanks to the University of Southampton. And indeed, the capacity you just described at the University of Southampton is very real for us, and indeed, University of Southampton is really our go-to partner for this kind of work, so it's a pleasure to be here. If I could have the first slide, please. Okay. So, indeed, mapping population data is something which UNFPA cares a lot about, and the way we manifest that in our work is to help many countries. Probably, I think in the last census round, we assisted about 130 different countries to conduct their standard population and housing census. Okay, so that was the 2010 round. And what we learned in the course of helping countries run their census is that you have lots and lots of countries still running paper censuses, and often census data are generated and then underutilized. What we now in this round are particularly tasked by are the demands of the SDGs. So the SDGs have set an extremely high bar for all of us involved with using data for development. And what they've done is said, if you look at the SDGs 1718, they've said that not only do countries have to collect data, meeting targets for more than 240 indicators, but in addition, they should be disaggregating every indicator by geographic location at very, very fine levels, but in addition, then also disaggregating by age and sex and some other more standard variables. But this task to ask developing countries to disaggregate all their data in a census by geographic location, I cannot underestimate or overestimate how big a task that is and how large a gap we have between the capacity today in most national statistical offices and what would be required for that to be possible and to be carried on an annual reporting basis. Okay? Now, it's probably a little ironic to talk about geography and why it matters to the National Geographic, in the space of the UK's Geographic Society. But in the context of population and geography, there's lots of different data here, very standard data that we collect in the census listed on the left-hand side. And obviously, to make some of those data particularly useful to the SDGs or to development, you need additional data sources. And I think it'll be Andy in his presentation and Edson who will talk a lot more about how they do that. But for us, if you look at the right-hand side of the screen, from the perspective of the United Nations, what are we actually trying to achieve with this kind of a partnership and this kind of support on census? First, of course, we track demographic dynamics, and I'll show just 1 or 2 slides on that. But really the issue is to map inequality. And the development arena of the world today says we're all supposed to be not only identifying and locating those who are furthest behind, but we're actually supposed to serve first those with the greatest need. So we do have indeed to locate and identify them. And mapping spatial inequalities through the demographic and health surveys, and we have Sunita here in the audience, who's the head of the DHS, has been possible, but not at the finest level one might need to be able to distinguish, is it a ward level in the east or ward levels in the southwest, where we actually have, for example, the highest levels of child marriage, and hence interventions should focus there. But I separate those, just the sort of generation of data, from also then the application of this work. And that is, of course, targeting interventions, and in an ideal world, being able to track the impact of very specific investments, which are often unto themselves geolocated. So we find, for example, in the arena of female genital cutting, which we work on very closely within UNFPA, that we have in a given country. UNICEF is working in 2 districts, UNFPA is working in 3, the government's working in 6, and different types of interventions are being tried. But the data are not fine enough for us to say, it's those which, let's say the four experts from the government, 4 districts the government's working on, where in fact, in very short time, you can see they're having the greatest impact and reducing cutting. And that's the kind of information we need, not only so that donors can say this is the intervention to scale, but much more importantly, so that the governments themselves with limited resources can know when they're trying to achieve certain development goals, these are the locations and these are the types of interventions that should be invested in. Okay? And last, I'll give just a little bit of comment with respect to humanitarian preparedness, because I think that's obviously of interest to everyone here. Now, very simply, just in terms of tracking demographics, this is a map with the phenomena of different countries in the world and median age. So it starts in the upper left, and it actually circles around here to 2100. We have experts in the room. But this is extremely interesting, I think, for anyone interested in aging. And we're tracking, because we work on aging programs as well, we're tracking what is happening to median age globally and in each country. And you can see, in fact, that this is moving extremely fast, where the median age is still close around 20 now, but it's moving, it'll move to about 27, and then it'll move right up until the early 40s by about 2100, with the exception, of course, will be Africa. Now, things may change, but being able to track these shifts in median age is enormously valuable for individual countries. Moving to subnational population work now combined with different types of inequalities, these are just 2 maps, one of Lilongwe in the top bar, and then in Blantyre, 2 cities in Malawi. And if you look here, we have demographic data mapped on the left-hand side. These are population densities within very specific city boundaries or traditional authorities. But here, what you can do now, we see, let's say, the lower right, you have sanitation data. So again, beginning to look at where sanitation data and population densities are aligned and where next investments in sanitation might be most ideally located to reach the largest number of people who are in need. UNFPA, as I said, as a population fund, we do this work on census, and then a lot of our programming work is in the arena of reproductive health, sexual and reproductive health, and women's rights and empowerment. And hence, for us, when we partner and work on these types of data, the interest is in mapping some of the key shortfalls that we're most concerned with programmatically. And here's an example of child marriage. So this uses the census from the 2010 census in Zambia, and it actually maps two things. First, it maps the districts which have the highest percentage of girls being married under age 18, but because it also has population numbers, it can quickly turn over to the government and say, these are the 15 districts where the largest absolute number of girls will be married under age 18 in the next few years. So again, interventions can be targeted. Another example for us in terms of targeting interventions, this is Togo, the country of Togo, and this is access to emergency obstetric care. So again, it's overlaying population densities, but then it's looking at where are basic emergency obstetric care facilities located, and then makes an effort to estimate time traveled to those locations by individuals. And on the left-hand side, where you see a lot more of the red bars, this is where you have a lot greater distance, but that's really because what they've mapped here is walking and by little motos. Whereas on the right side, if people actually had access to vehicles, then already the time required, or the number of people who have access, of course, is much diminished. This is an example of combining data in a slightly different way. This is a small area estimation. Once we have the census, we can, in fact, extrapolate from a different type of survey. Here we have a survey of the Demographic and Health Survey on the lower left-hand side. And this takes a family planning indicator that's very common and, in fact, is an SDG, which is the proportion of demand satisfied by modern contraception. So it's a kind of a very nice proxy for access, generally. Who has access to family planning? And with the DHS, we can get down to provincial and in some countries a bit lower. But when we actually run a model combining census and the DHS, we can start to provide information at much finer resolution. So what looks like large blocks of provinces in Nepal with large aggregate estimates, the mean estimate for that area, you can now start to see that in a highly variegated way and think about the delivery of services with a lot more sophistication. This is another example. This is a very recent example, and this is around youth migrants in the city of Nairobi. And where you see red dots, there were some purposeful engagements where there was large clustering of youth migrants in these parts of the city. And then there was a lot of interviews, and young migrants saying they had very little access to any health services. So we said, well, let's just map, is this about proximity or is this about other challenges? And as you can see, then mapping the health facilities, it was far less about proximity and much more about true access and the challenge of language and reception in the context of the health facilities. There are more examples. In the interest of time, I'll probably be very abbreviated, but this is an example for something like the demographic dividend, or if you think about multiple types of support and development you need for young people to be successful. This makes an effort to combine something like child marriage, in addition to underemployment, to access to secondary school in a composite index, and then map that so that if you're trying to think where, again, should the greatest investments be across numerous variables, there are ways to create composite indicators. Last, let me turn to humanitarian preparedness. This is work that was done using the Indonesian 2010 census, where the population density is mapped against floodplains and also landslide zones. And this is an example that the government was asking for. Can you please help us use the census so we can start to see which Actual areas may be, in fact, both this combination of highly risky, but also very, very dense in terms of population. And finally, in the humanitarian space, because again, with data from Nepal, this is with respect to the earthquake, not a few years back in Nepal, mapping out proximity to the earthquake and being able, in terms of both preparedness and response, to have the population data that enables us at a fairly high resolution to say how many pregnant women would be in that area, because UNFPA offers services like delivery kits to make sure that those come in quickly in a crisis and in a humanitarian situation. But all of this is, in some respects, a scatter of success, little examples here and there. An organization like the United Nations Population Fund doesn't have the academic team that could ever, at scale, be able to really kind of generate the range of questions governments ask for at scale and for many, many countries. It's simply not the nature of the work that we do. And hence, for us, the idea of partnering with key academics who have these skills and can do this kind of modeling is really, I think, for us, the wave of the future. These types of more complex partnerships where we do a lot of the work with governments, enabling the questions to emerge. We generate help census data, and we look to places like the University of Southampton for the more complex modeling that can, in fact, deliver services, and then we'll turn and come back in the game and start delivering services. But let me just leave you with a list of significant challenges. One of those, of course, is we have governments that have many other things on their plate and in their budget, and there may not be a very high commitment to census. We also have countries extremely committed to census, but with deeply insecure areas, and so we end up with incomplete census. So we have, you'll hear from Andy because of some partnering we did. This is true was true, of course, in Afghanistan, but I can tell you right now, the number of countries where some kind of modeling would be needed to, in fact, complete a census is becoming extremely high, and it's worrying because we have a lot to deliver. Also, I think a major challenge is agreed access to data. So we have also the phenomena of a certain anxiety, understandable, to share broad, full microcensus data sets, because there's a lot of information there which could identify individuals. We saw the Rohingya crisis as an extremely horrifying example of exactly that, where the census had been done, Rohingya had been identified, and I think we all know how this turned out. So really terribly. So these kind of trade-offs, where's that sweet spot between having data available but protecting identities and aspects of individual data that might in fact put people at risk, is a big challenge. And then I think there's no question, given the opening of the opening film was perfect for us, because the mobility of populations today, in part also because people have more resources, and so in fact people can move when in fact there's, let's say, a better opportunity in a neighboring country. But mobility is high. It's not only, of course, high Africa into Europe, but it's extremely high within and between developing countries. That's where the major migration is. But this challenge of conflict areas is really acute, and it interrupts not only the execution of a census, but where governments are often destroyed, and you have the loss of the national NSO, the archived data. So the ability to actually pull data that may well be in the country prior to a crisis becomes impossible thereafter. Okay, and then of course it's the limited capacity. I won't show too much here, just to say the last couple of slides. These are the countries that were without a census in the 2000 round, and these are the number of countries that missed a census in the 2010 round. It went from about 21, 22 countries in the first round down to 14 or 15 countries, but it's still about the estimate based on the UN Pop Division projections. We're still missing about 8-9% of the global population in terms of no census, which is why for us, a big priority has been Pakistan, and I'm proud to say accomplished. Census was done in Pakistan, and I want to thank the British government, because the British and was UNFPA were the two development actors that stayed in to the end, and it was accomplished in 2017. And now we have a major initiative to try and bring the DRC. They haven't had a census since 1984. only one at the start of the country. So this is a major concern and interest for us as now. Okay, a little bit more about UNFPA, the types of things I think I've already elaborated that we're working on, which is to make sure that all censuses are now conducted with handheld devices so that there is the possibility to take GIS and to be able to create enumeration areas that are reliable, gridded population data as well. And of course, it's through partnerships, if you look down at the fourth bullet point, with people like Flowminder, that we hope to be able to do much more in the way of hybrid census. And I think you'll hear a little bit more about GRID, so I won't say much, but again, thanks, call out to the UK government for your support to this geo-referenced project that the UNFPA is delighted to partner with Flowminder and World Pop on, and this is what's enabling more and more countries to have some capacity strengthened, and also to have a potential for estimating populations where security precludes a traditional data gathering. And I say thank you for the time. Should I stay here? Okay.
So thank you, Rachel, for that great introduction and setting the scene. We're going to hold questions till the session afterwards, and we're going to go straight on now to the next keynote. So I'm delighted to introduce Professor Andy Tatum, who is going to be talking about mapping population distributions, demographics, and dynamics. Just going to say a few words about Andy as he comes up to embarrass him. Andy is Professor of Spatial Demography and Epidemiology at the University of Southampton. He's Director of World Pop and Flowminder. He leads a group of more than 50 researchers and data scientists. He is interested in how populations, their characteristics and their dynamics can be mapped at high resolution across low and middle income countries. He runs international collaborations with national governments, UN agencies, and data providers, and he leads multiple research and operational projects. Welcome, Andy.
Okay. Thank you. Thank you, Rachel. So yeah, I'm going to talk about our work at Southampton in the World Pop Group and Flowminder Foundation on trying to meet some of those needs that Rachel has outlined. Just starting off here, you may read in the newspapers, Brexit, Trump, everything's looking bad, but this graph pretty much shows us that things are getting better. Each one of these points is a country. We've got income per capita, we've got life expectancy on those axes, and every country is making its way up to that top right corner. So there's good news stories here. The world is getting better. But when we start to break things down subnationally, we start to see that perhaps some parts of some countries are being left behind. So here's a graph of under 5 child mortality rate, a good indicator of overall development. And we're mapping out the worst region and the best region. I just draw your attention here to Niger. The best region there is really performing pretty well. We've got the level of Albania, Ukraine, Maldives, but its worst performing region is really being left behind. And so there's great heterogeneities there that those dots on that first graph just gloss over. And as Rachel has highlighted, we have the Sustainable Development Goals launched in 2015, a big fanfare there of trying to address some of these problems. We had a whole list of A-listers, Obama, the Pope, DiCaprio, and some other non-A-listers, Jamie Oliver, Shakira. But in those, there's a huge complexity here of 17 goals, 169 targets, all targeted on all kinds of things to make the world a better place. And a key theme in all of that is this leave no one behind that Rachel mentioned, and achieving those goals everywhere. And achieving them everywhere means that geography starts to become pretty important, which is a good thing, I think. And if we look at just the very first goal here, goal 1.1, end poverty in all its forms everywhere. There's that word again. So by 2030, eradicate extreme poverty for all people everywhere, measured as people living on less than $1.25 a day. So to do that, we need good maps of everywhere. We need good maps of where and how many people there are everywhere. And we need good maps of the level of poverty everywhere. If we're ever going to, first of all, work out how many people there are in poverty and then track that progress towards meeting that goal. So if you came here today, you probably used Google Maps on your phone, and it's amazing that every single building is mapped. If you go to a big city in the middle of Democratic Republic of Congo, this is 2 million people, this is Lubumbashi, this is what you find. Good for mapping a gas station, but not good for mapping every single building and tracking progress towards eradicating poverty. If we go to rural areas, this is the village I grew up near Bath. Every single building, again, mapped out. If we go to the equivalent village in Democratic Republic of Congo, there are buildings there, but these people are just not on the map. And it's very hard to make sure no one's left behind if we can't actually find these people. It doesn't mean maps don't exist, but often the maps that do exist look like this, and it's not ideal to be trying to eradicate poverty when finding these people means turning right at a cow. So there's challenges here. And if we look at population maps, this is the UK, although the census was in 2011, incredible detail, and we can keep those data up to date with registries, with all kinds of surveys. If we go again to the Democratic Republic of Congo, a country the size of Western Europe, so each one of those units there is about the size of Austria or Scotland. And as you can see, there's data there, but as Rachel mentioned, that data comes from 1984, those population numbers. So a huge amount of uncertainty of how many people there are and where they are. And then in terms of those poverty maps we need, the UK again has some pretty incredible data in terms of index of multiple deprivation this is, and can be kept up to date with surveys again. For DRC, I haven't found anything. So there's again a lack of data for that goal 1.1. So what can we do? And in the WorldPop group, we start to use different types of data to try and fill those gaps. So firstly, this is demographic and health surveys data, which often takes the place of a census in terms of providing statistics more regularly. And it can be summarized like this: half women are literate in Nigeria. You can break it down by large regions, but each of those regions is about the size of England. And so a lot of heterogeneity is missed. But increasingly, these national surveys are taking with them GPS to measure where they're going. So each one of those dots represents a village. We have a sample of about 40 households in each one of those villages, and the dot shows the result of the literacy rate. So it's small sample sizes, and so it's not ideal, but it gives us a much more picture of that spatial detail that we've never had before. And I'll show later on how we can start to use that data. Another form of data is geographic information systems. So before the earthquake in Haiti in 2010, the data looked pretty similar to that Lubumbashi example I gave. But as volunteers around the world started digitizing satellite images, we got increasingly detailed amounts of information. And now Port-au-Prince is one of the best mapped regions in the world. But it took an earthquake to do that, and there are large areas of sub-Saharan Africa that don't have this kind of data. Satellite imagery is another data source. So when I was doing my PhD, this is the kind of images we were working with. This is somewhere in Uganda. You can just about make out that there are some green areas and some gray areas that might be settlements. But over the years, satellite imagery has improved so that we can start to identify settlements. And nowadays, we are routinely exposed to this kind of imagery from Google Earth, where you can see individual buildings, sometimes individual people. So it starts to get towards that kind of mapping of that we may be able to get. We see individual buildings for London. We can get towards that using satellite imagery. We also use other types of satellite imagery. So this is something you'll regularly see, the Earth at night. There's interesting patterns in there of South Korea and Kim Jong-il's house, I think, in the North Korea dot there. But not only satellite images, but amounts of vegetation, topography, land use, and the mapping of settlements. Computers are getting better and better at recognizing these settlements. So a huge amount of data. The other form of data comes from mobile phones. And 30 years ago, if you had a phone, you would probably look like this and have not many people to phone. But over the last 10, 15 years, the phone ownership has surged, particularly in low-income countries, where we are now up to 80–90% of adults owning a phone. It's still biased data. We're still not capturing everybody, and it's often the poorest and most remote that are not captured by these kind of data. But they're getting a better and better data source. And the kind of data source it is, if I make a phone call now, receive a phone call, send a text, receive a text, that is routed through the nearest tower and recorded as a billable event by the mobile company. Maybe I moved across the street and made another call or text that's routed through a different tower at a different time. So across a few hours, I'm leaving these digital breadcrumbs of where I've been anonymously, but it's valuable data when aggregated together across the millions of people who now are using these phone networks. We see this is the movement patterns of many millions of people across 3 months in Bangladesh. So what we do in WorldPop is build this giant data sandwich. I know you're missing your dinner, but hopefully this does not make you too hungry. But this is the data representation. So in there we have the more traditional statistics from census mapped to administrative boundaries, from the GPS located survey data, from road networks, from the location of health facilities, satellite imagery, and the mobile network data. So, and we push all of that into a kind of gridded format. So we divide up the world into 100 by 100 meter grid squares. It gives us a consistent, comparable way for integrating that data. We can always aggregate it back up to admin unit levels that decisions are often made at. But it gives us a flexible way of integrating data. So we can look at where's the location of health facilities and how does that relate to where women of childbearing age are. And we can aggregate that in different ways that I'll show later on. So how can we make use of this monster data sandwich? Here is a satellite image of rural Afghanistan, and with our brains and eyes, we can pick out where all the compounds are, where the people are living, but it would probably take me years to do this for the whole country, drawing squares around each one of those boxes. And when I was growing up, this is the kind of computer I had, and it couldn't even read that image. And now my mobile phone has 50,000 times more power than that. But we do now have this kind of supercomputer with masculine names like Titan and multiple other types of capacities to be able to handle these kinds of data so that you can tell the computer, this is what a compound looks like in Afghanistan, train it on a very small bit of data, and within a milliseconds, it can map out and extract those buildings. So we start to get to that picture of what we need, of where all the buildings are. And how this is useful, we can firstly, if we have census data at a kind of administrative unit level that is not so useful for integrating with other data sets, we can start to look at what is the relationship between those population densities at that aggregate level and those higher resolution data sets from settlement layers, from land cover, from the nighttime lights, and build a statistical model to translate those densities from the coarse administrative unit level to a much finer grid square prediction. And we've done this in WorldPop across the whole world, disaggregating from administrative counts. We've done this over different time periods. This is China, 1990 and 2010. And in the census, we have counts of the different age and sex structures, so we can map things like women of childbearing age. We can also integrate different data sets of, on the bottom there, age-specific fertility rates from demographic and health surveys to adjust some of those data sets to estimate births, pregnancies. And all of these data sets are available for free download from the WorldPop site. But, of course, there is a problem that Rachel highlighted very well. There is a basic data problem in some of these countries. If we're disaggregating from census counts and the census is from 1984, we have a lot of problems. It's bad data in and bad data out. And it's not just DRC where there's a problem. There are many countries where this is a major problem. Plus, populations are often missed from censuses. There can be inaccuracies, they can be incomplete. And even the best census, there are changes in that intercensal period. So what I've just shown is this kind of top-down approach where we're taking census counts that we trust and disaggregating them to a grid. But what we've been working on more recently is this bottom-up approach, this hybrid census that Rachel mentions, where small samples of population data can be taken much more cheaply, faster to produce these gridded population data sets. And an example of where we have done this, Afghanistan, the last census was 1979. The current estimates are just based on projecting those numbers 2% each year. So huge uncertainties in the national population totals. And about a third of the country is covered by a more recent census, which you can see here. But the government just can't go to the other 2/3 because of insecurity. So there's a challenge in what can they do. But we do have across the whole of the country this data sandwich. We have data coverage across all of those unsampled areas. So we can look at what is the relationship between those data sets that we do have in the sampled areas and our data sets in the data sandwich. So we can start to build those statistical relationships to look at how does compound density from satellite images relate to population density. It's a messy relationship with some uncertainty, but there is something there. And we go through that data sandwich, the vegetation index, how does that relate? Settlement fragmentation. There's a whole range of these different relationships. And when we bring them all together, we can do a pretty good job in predicting into unsampled locations to go from this picture of incomplete estimates to filling in those gaps. Of course, it's not perfect, and measuring that uncertainty is important in this because we are predicting into those areas where we don't have data. So that gives us a way to get to those counts, but how do we get to, if we're thinking about goal 1.1 again, how do we get to those development goal metrics? So here's a little quiz. Can you pick out the rich area and the poor area here in Sao Paulo? That's pretty easy, but could you say how rich is the rich area and how poor is the poor area and how that changes year on year? That's hard. This is Dhaka in Bangladesh, a similar situation of poor and rich areas. And this is where things like the demographic and health surveys come in, where samples are taken from each of these regions, asking questions about income, about expenditure, about consumption, to get a metric of poverty for samples of households. And across an entire country, you get a picture like this, where there are samples of those households. And that gives a picture of that heterogeneity, but again, it's small sample sizes, it's an incomplete picture. But what we do have is some kind of relationships we can see, and poverty rates tend to be higher in those areas that are a long way from major roads, the inaccessible areas. They tend to be lower in major urban areas. We also see relationships of the amount of how people move. People move more that are richer. They spend more on their mobile phones. We also see on the mobile phone data that people in the higher socioeconomic percentile call more people. They have more contacts. And these are all relationships, again, that we can leverage so we can map out these things across the country, the distance to roads, the brightness of nighttime lights, the vegetation index, but also from the mobile phone data, what percentage of calls are made at night when call rates are cheaper? How much do people top up and spend on their mobile phone each week? And the radius of gyration. This is not a kind of dance. This is how much people move. So we can, again, leverage all those relationships to go from this incomplete picture to predict into those gaps at quite fine-grained resolution and do a pretty good job statistically. But importantly, it's not a perfect job, so mapping out that uncertainty as well to accompany those data sets is important. So that gives us a kind of static picture. Unfortunately, as Rachel again highlighted, people move. They move a lot, increasingly so. And this is where the mobile data can come in to start to help and fill that gap. So this is a little movie of where we experimented with what we could do with mobile phone data for not a low and middle income country. This is France, as you can see. And we looked at how did the density of mobile phone users translate to the density of population by comparing a statistical model to compare the census against the density of phone users. And we could do a pretty good job in producing a population map just from phone users. Of course, the benefit of the mobile data is that it's collected every single minute of every single day. So we are not just having this static picture, but we are looking at how those populations move around and how those densities change. So you can see Here we go, going through the week of Monday, Tuesday in the cities. Here we go forward, Monday, spending their time in the city, Tuesday, Wednesday, Thursday, Friday, escaping into the vineyards, Saturday, Sunday in the countryside, and then back to work again. And as the holiday period comes along, people are escaping to the coast, but it's these dynamics that we've never been able to capture before with any other kind of data set. How this is useful, if we think about, this is a health facility in northern Namibia, and often pinned to the wall is something like this that tells you, this is my population, this is my denominator. Total population is 1,928 people. That's great for a denominator, but often those population numbers are changing. So if you have 100 malaria cases recorded there out of a population of 100,000, that's a problem. Or it's not a problem. If it's out of 100, then you have a serious problem and a serious outbreak. So getting that denominator right is pretty important. And this is where the mobile data can come in to make those population maps, how they're changing seasonally, and to give a more accurate picture of those health facility catchment populations. And now we have a way to start to measure those catchment populations and the demand on resources. It also gives us a way to measure population changes in the event of a disaster. So it can be chaos in the event of, in this case, the Nepal earthquake. But by measuring those population flows from the mobile data, we can look at how those populations were displaced and give quick answers to how many people were moving out of Kathmandu. So to finish off, maybe these are crazy ideas that will never find real-world use. Well, I think many of them probably are, but there are now wider and wider uses of the geospatial data, these population data in applications. The UN response agencies are often using these type of data to look at the populations affected. We have examples of these data being used as a denominator in health metrics nowadays, feeding into health statistics from the World Health Organization. These kind of data are used in reports where a finer grained detail in terms of the number of pregnancies and births are required. They're used to look at birth at risk of skilled birth attendants here in East Africa. In the disaster response world, the mobile data is now becoming commonplace to look at response of where people are being displaced. And in terms of disease elimination, understanding how regions are connected and how diseases are being imported to different locations is becoming a commonplace. We've seen these kind of data being used to prioritize where bed nets and malaria response, malaria interventions are distributed. And in terms of those population data sets, they are now forming the basis of national statistics. So here's me in the least gender-balanced meeting I've ever been at. But this is the president of Afghanistan giving the okay for these data sets to be used. And as Rachel mentioned, we have this new grid program where these data sets are being promoted, and we work closely with the statistics office to build them. This is an example for Nigeria that you can see later on upstairs and play around with those data. So just to finish, hopefully I've shown that those national and regional metrics hide significant inequalities. And it's important for reaching those left behind. Those traditional data sources remain vital. We need those censuses and surveys, but they can be outdated and incomplete. There are challenges for countries to collect that data. So those new data sets can help complement them, fill in some gaps, but they're not perfect. So we need methods to measure that uncertainty. And importantly, if we're ever going to get these sustainably used, we need that local ownership and engagement, and importance of partnership with UN agencies like UNFPA to do that. Thank you. I will finish there.
Thank you, Andy. That's so impressive. So finally, I'm going to welcome Dr. Chigozie Edson Utazi, who'll deliver his keynote, Mapping Childhood Vaccination Coverage and Other Development Indicators in Low and Middle Income Countries. Just a few words about Edson. He's a senior research fellow within the World Pop Group at the University of Southampton. He completed his PhD in statistics at Lancaster University, during which he worked on spatio-temporal modeling of partially observed processes. Edson has interest in developing novel approaches in spatial and spatio-temporal statistics and applying these to solving health and development problems. Currently, his work focuses on mapping the coverage of childhood vaccinations in low and middle-income countries. Welcome, Edson.
Thank you, Rachel, for that introduction. So I'll be talking about the work that we have been doing to map the coverage of childhood vaccinations in low and middle-income countries. I'll also talk about what we've been doing to map other development indicators. So I'll first of all provide some background to our vaccination coverage mapping work, and I will discuss why population data that Andy talked about are important for coverage mapping and estimation. And then I will discuss the data and methods that we use to produce maps of vaccination coverage. I will demonstrate how these maps can be used for operational decision making. And then I'll present some maps, predicted maps of vaccination coverage. And then I will talk about other indicators in the end. So the vaccination mapping work that we do is a joint effort between Southampton and 3 other universities, which are Princeton University, Johns Hopkins, and Pennsylvania State University. And this project is funded by the Gates Foundation. So vaccination has been tagged one of the most successful and cost-effective public health interventions. That's because vaccination led to the eradication of smallpox in 1980. And as a result of vaccination, the world is closer than ever to eradicating polio, with only 3 endemic countries remaining, which are Nigeria, Afghanistan, and Pakistan. And globally, there are concerted efforts to eliminate other childhood infectious diseases, such as measles, diphtheria, tetanus, and pertussis. So over the years, vaccination has been a proven tool for disease control, elimination, and eradication. And to further put things into context, it's on record that every year immunization averts an estimated 2 to 3 million deaths. And in the case of measles, vaccination averted 21.1 million deaths from measles between 2000 and 2017, and that's a decline of about 80% within this period. So, but despite these successes, we know that many children around the world remain unvaccinated, and vaccine-preventable diseases have continued to cause deaths in children in low and middle-income countries, as we can see on this plot here, which shows the coverage of measles vaccination among 1-year-olds in different parts of the world. And we can see that Africa is lagging behind there compared to other parts of the world. And we can also see in this map, which shows deaths from measles around the world, we can see that most of the burden of measles is concentrated in Africa and Southern and Southeast Asia. And this explains why we focus on low and middle-income countries in our work. So the SDGs were launched in 2015, and SDG Goal 3 aims to achieve universal health coverage, and that includes access to basic health facilities and access to vaccines for all. So this work that we do forms part of the evidence base to guide the design and implementation of interventions, as well as providing a mechanism for monitoring and evaluating progress towards these development goals. So why are population denominators important for mapping vaccination coverage? I think that the answer to this question is encapsulated in this equation, which defines vaccination coverage as the proportion of the target population that is vaccinated. So what this means is that we need accurate estimates of the target population to be able to obtain accurate estimates of vaccination coverage. So in terms of general program design, planning, and implementation, population data are important. So if we are looking to plan a routine immunization in a place in northern Nigeria, for example, we need to know numbers of children aged under 5 living in that region, and we need to know if the number of health facilities is enough to guarantee access to vaccination services in that region. And admin estimates of vaccination coverage are obtained by dividing the number of doses distributed by the size of the target population. So if we do not have an accurate estimate of the target population, we will not be able to estimate vaccination coverage. So, and that is why you have admin coverage estimates of 150%, which do not make sense sometimes. So if we want to evaluate the build-up of susceptible children in low coverage areas, we need to have accurate population data to be able to do that. And that information can be useful for timing vaccination campaigns. So more often than not, we estimate vaccination coverage from survey data. So surveys take samples from populations, and for these samples to be representative of the populations, we have to know what the true population is for us to be able to take a representative sample. And recently, gridded population data have become useful for designing vaccination coverage surveys in countries where census data are outdated. And of course, when we have estimates of vaccination coverage, we need accurate population data to be able to estimate numbers of unvaccinated children. So if there is an outbreak in a country like DRC, for example, we need accurate population data to determine how significant that outbreak is. We need to know what numbers of children are affected by the outbreak. We need to identify areas that are in greatest need, and we need to figure out how best to control this outbreak, how much vaccines that we need, how to distribute cold equipment that is used to store these vaccines. And we need to know how many field workers to send to different areas in order to be able to control the outbreak. So in this work, we try to focus on high-resolution, age-structured mapping of vaccination coverage. Now, why do we do high-resolution, age-structured maps of vaccination coverage? It is because vaccination coverage is traditionally measured at the national level. As you can see, we can have an estimate of coverage for a country that is as large as DRC, or it can also be measured at the scale of large regions, as you can see here for DRC. So these are admin level 1 areas within this country. So we could have estimates for these large areas. So, but the problem with such estimates is that they mask important geographic inequities in coverage. So we need to know if within these areas there are areas that are performing well, and we need to know areas that are performing badly, and we need to identify the areas of low coverage, and target those with interventions in order to improve coverage levels. So there is a need to estimate the heterogeneities in coverage, identify cold spot areas, and if we have areas that have a high coverage level, we need to know whether there are under-vaccinated locations within those areas, so that these locations could be targeted before things get out of hand. And of course, if we have estimated the cold spot areas with precision, we will be able to determine if significant numbers of children live in these areas in order to assess the risk of outbreaks in such areas. Now, age is an important factor in vaccination coverage mapping, and that's because vaccines are administered to children when they have attained certain ages. Take, for example, measles vaccine. So measles vaccine is administered from age 9 months And that's the first dose. And the second dose is given to children when they have attained ages 15 and 18 months, especially in low and middle income countries. So we want to know if children are getting vaccinated when they become eligible to receive these vaccines. And the high-resolution maps that we produce, they facilitate integration with population data that Andy talked about earlier. And the good thing about having high-resolution maps is that we can always aggregate from the grid level to any administrative level that we want to facilitate policy making and implementation. So there are two methodological approaches that we use to produce predicted maps of vaccination coverage. So the first approach relies on what we call point reference data. And both approaches make use of survey data. So household surveys are surveys that are carried out in low and middle income countries that provide data on a wide range of health and demographic indicators, with vaccination coverage being one of them. So here we have an example of the distribution of survey locations in Nigeria. So the red dots are survey locations where low vaccination coverage was found, and the blue dots are survey locations where higher levels of coverage were found. So you can see that the blue dots are concentrated in the southern part of this country, whereas the red dots are in the north, which shows that the northern region generally has lower coverage levels compared to the south. Now, for some countries, we do not have access to point reference data. So the data that we have available to us are aerial data. So we have coverage levels for these admin areas in the country. So with each of these data sets, the aim is to predict vaccination coverage at unsampled locations. So with point reference data, we'll be looking to fill the gaps in this map. And with aerial data, we'll be looking to move from these large admin areas to the grid level in order to uncover the heterogeneities that exist in vaccination coverage within these areas. So, but to do this, we need some coverage information. We need data on factors that are related to vaccination coverage. Now, coverage data serve two purposes in vaccination coverage mapping. They help explain the variation that we observe in coverage levels, and they allow for more accurate prediction of vaccination coverage. So for this work, we have a lot of covariates that we use. So this could be demographic variables, things like population density, ethnicity. This could be remoteness variables, things like travel time to major cities, as we can see here for Mozambique, with the brown areas being areas where travel time is high, and the yellow areas being areas that are close to cities or high population areas. And we could have some economic variables because we know that children that live in poor areas, for example, tend to have lower coverage levels than children that live in richer areas. So we could have land use information and some information on environmental variables and agricultural variables. So with point reference data, we integrate this covariate data with the household data that I talked about on vaccination coverage. And we process the covariate data for each of the survey locations. We perform covariate selection to identify the covariates that are important for our work. And then we go ahead to produce predictions of vaccination coverage at a high resolution. And we do a similar thing with area unit-based data as well. So, but we have a different kind of model that we use to produce predictions at the grid level because these two data sets are different. So we've been focusing on 10 priority countries which are listed here. So here we have an example of predicted vaccination coverage map for Nigeria. So showing that the northern region is a low coverage area compared to the southern region where you have higher coverage levels. And this map was produced with an accuracy of 95%, which shows that we have a high degree of confidence in the predictions that we have made. And here is an uncertainty map that shows the level of confidence that we have associated with these predictions, with the blue areas being areas of low uncertainty and the red areas being areas of high uncertainty. But overall, the levels of uncertainty that we've estimated for the predictions are generally below 20%. So here we have age-structured maps of vaccination coverage. So there we have a map of vaccination coverage for children aged 9 to 11 months. There we have a coverage map for children aged 12 to 23 months. And then we have a map for children aged 24 to 59 months. And you can see that children are not getting vaccinated in this country on time when they become eligible to receive measles vaccines. But as they get older, more and more children are getting vaccinated. So here we have an example of DTP3 vaccination coverage for Ethiopia. We can see the divide between the eastern region and the western region, with the eastern region being a region of low coverage compared to the western region. So that is coverage with the first dose, that is coverage with the second dose. So we can see that when we get to the second dose, more and more red areas start appearing, and the same thing happens with the third dose. And what that tells us is that the health system in this country has performed poorly in terms of following up with the later doses of vaccines. So these are the uncertainty maps to go with these coverage maps, which shows that these maps were predicted with low uncertainty. So when we've produced these high-resolution maps of vaccination coverage, what do we do with that? We can integrate this map with a population map which we obtained from the World Pop Program. So here we have a number of people per grid square, and we would need information on the distribution of children, proportion of children aged under 5 years within this country. So when we integrate the population map with this map of the distribution of children aged under 5 years, we will be able to obtain the spatial distribution of children aged under 5 years. And when we integrate that with our vaccination coverage map, we're able to estimate numbers of children who are unvaccinated across the country. So there are other things that we can do with these maps that we produce. We can estimate cold spot areas. We can assess progress towards vaccination coverage targets, and so on. So we also use these maps to explore the effects of delivery mechanisms, because vaccines are administered in different ways, either through routine immunization or through supplementary immunization activities, which are activities that are carried out to boost coverage levels in low and middle-income countries. So when we compare maps of measles and DTP, we will be able to determine areas where vaccination campaigns have been effective and areas where routine immunization is lagging behind. So as this map shows, for DRC, we've compared the coverage of measles with the coverage of DTP3, and we can see that SIAs have been effective in boosting coverage levels in the northern part of this country compared to the other two countries, which are Ethiopia and Cambodia. So I'm just going to skip all of these and go to other work that we have been doing to map other health and development indicators. So here we have a map of stunting in male children aged under 5 years. Stunting is a condition that causes impaired growth and development in children, and that could be as a result of malnutrition or some other health conditions. So you can see that there are large numbers of children in the northern part of the country who are stunted. So we also have this map of women with access to a skilled birth attendant in 5 countries in East Africa, which are Kenya, Tanzania, and Uganda, and Rwanda, and Burundi. And we also have a percentage of women who are literate at 1 by 1 kilometer grid squares. With all this work that we have been doing, we've been building an atlas for mapping progress towards the SDGs. So from our population mapping work to vaccination coverage mapping and all the other SDG indicators. Thank you.
That's fantastic. Thank you, Edson. And I'm sorry for rushing him at the end there, but we're going to have a time for some questions now for the whole panel. I just need to introduce Professor Jane Falkingham. Jane is the Dean of Faculty of Social Sciences, and she's going to host the question and answer session. So, Jane.
Thank you, Rachel, and thank you to our speakers so far. As well as being the Dean of the Faculty of Social Sciences, my title is actually Professor of Demography and International Social Policy. And if I could go back in time, I think I'd like to do a master's in demography again. So when I did my work in demography back in 1984, where we were running censuses in DRC. And it's fair to say that the work that we've just seen tonight is revolutionizing, absolutely revolutionizing the discipline and how we as demographers carry out our work in developing countries. So everything I learned is completely irrelevant now. But that is really why it's so exciting to be in academia at this moment in time, and particularly to be at Southampton, because I also have another title. I wear 3 hats. I'm also the director for the Centre for Population Change, where the first 2 speakers in this series came from. And the combination of having the Centre for Population Change sitting alongside WorldPop at the University of Southampton does make us the UK's and Europe's and possibly the world's Centre of Excellence. So I'm really thrilled, and thank you, colleagues. So I'm going to invite our speakers to come back to the stage, and they're going to be joined by 2 additional panel members. I'm really delighted to welcome Garnet Compton, who's the Head of Statistical Design and Quality for the 2021 census at the Office of National Statistics. I'll get him to introduce himself as well in a moment and tell us a little bit about what we're doing in the UK. The Centre for Population Change is delighted to be officially partnered with the ONS. Of course, ONS is just down the road at Titchfield, so nice and close to Southampton. And I'm also delighted to welcome Professor Zoe Matthews, who's Professor of Global Health and Social Statistics at the University of Southampton and is in my department and has been my line manager from time to time, and I'm her line manager from time to time. So perhaps I'm going to kick off the questions, and perhaps I'll just ask Garnet to say a little bit about the work of ONS and how it connects with the themes of tonight. Garnet.
Okay, that's a fabulous introduction. Thank you, Jane. And thank you very much for the invite to speak here or appear on the panel with such esteemed work that's already been shown. I'll just start by a small correction. That was an excellent introduction in terms of what I did about 3 months ago. I've recently moved, and why everything is so relevant. I now work in the ONS for the International Development Team, and I work on a project that's funded by DFID. I'm based at the UN Economic Commission for Africa, looking to provide additional support into some key areas that UNECA is helping to develop across Africa, which includes census taking, civil registration, data science capability, and some statistical leadership.
Thank you. And Zoe, you work on maternal health. So why are you here tonight?
Well, I've been invited, which I'm very happy about, and it's nice to be here. And it was really great to see all of the examples on maternal health that we saw in the presentations. Maternal health has always been a very important topic for me. I think a maternal death is still a very shocking and extremely avoidable event. And what comes with a maternal death is a child death. Often you get a newborn death or a stillbirth. And so working on these issues is still very important. It's still numbers 1 and 2 in that SDG 3. It's still not solved. And a lot of the work that I've done with Andy, actually at University of Southampton, is to work out these problems of maternal mortality, because they really go well with geographical analysis. I mean, you have to, the primary way to deal with a maternal death or a child death, or, you know, a potential one, is to make sure that women get into hospitals. That's really been the main thing. And that's a geographical problem. And some complications of maternity take a short time to unfold, and that means you have to get to a hospital very quickly. As a demographer also, it's a problem of birth, death, and migration, because you've got to get to that hospital. So as an academic, I suppose that's what's kind of motivated me. Yeah.
Great, thank you. So we have about 20 minutes for questions, and I'll start with Professor Hutton. A microphone is coming round. So great.
Thank you for those really interesting talks. I wanted to ask, in our experience, we're getting very good at identifying the issues using these approaches and you know, developing these sorts of approaches for mapping and the technological applications associated with those. Do you think we're making the same progress with policymakers and how they use this information? Because that, to me, in our experience in slightly different approaches to modeling, is you can train technical people in GIS and whatever, but actually the people who make decisions, we need a lot more emphasis. I wonder if that's your experience too. Are you coming up against that barrier? That's to anyone who wishes to answer. Sorry.
Rachel? Yeah.
In fact, thanks for the question. Let me say that I think that the mapping goes an extraordinary distance to making policymakers able to see and understand and react. Tabulated data, with all of our nice has not succeeded, but showing people a map is so accessible to non-experts that I think that's the sense in which I think it's transformative.
Anyone else want to?
But, well, I'll add something in kind of an African experience, in the sense of, I think it's still got a long way to go. It's, as you can all see, we're all kind of analysts, I expect, and can really understand the value of that, and we need to do much more, I think, to be able to communicate, well, what does this actually mean to policy? So starting to be able to demonstrate some of those impacts as they've been shown today and put that in a policy context, or demonstrate that to policymakers, is as a really valuable tool and kind of a real skill that needs to be built up alongside the analyst capability to be able to do this, to talk to the local policymakers. And I think that kind of works in the UK just as much as it does abroad as well.
I think it goes beyond policymakers as well. The map is so attractive for a policymaker. At Southampton, we developed something called the Atlas of Birth, where we use these maps of pregnancies and various other things. And very much we could speak to policymakers with those maps. But also, we've used them for accountability, so that an ordinary person who might be pregnant can understand those maps and then can demand something from their policymaker. So I think it goes beyond just the policymaker kind of relationship. I think this is a very transformative technology, you know, for accountability as well.
Great, thank you very much. I guess I'm going to take another question. Yes, please.
Thank you. Jumping off from that, I'm wondering about uptake and use at the country level or at the finer grained level of the successes, challenges, and I think I'm particularly interested in the requirements for that, of what needs to happen or what needs to exist for that to work well.
Shall I go? Yeah, I think there are a growing number of examples of use of these kind of data sets, but there is still a lag, and the important thing is to engage those who are likely to use the data at the very earliest stage to understand what is their capabilities. If we just build a map and then give it to someone and say, look, you should target here, often they don't have the capabilities, the organization to be able to react and organize themselves at those kind of scales. So it's that two-way relationship of understanding what are the limitations, what are their capacities to be able to work with this kind of data, and then we tailor our analyses to meet those needs. And that's the only way it's really going to be sustainable and used, I think.
Another question? Oh gosh, everyone's going wild now. I'll go to the back and then to the front, yeah.
Thank you. Charlie Heintoff from the Association of Commonwealth Universities. My question's about maps, which seem so foundational to everything that has been discussed tonight. And maps themselves are very political. They represent political biases, they can represent prejudices, or they can represent the power of the person that drew them. Be that the projections that we choose of the world, the Mercator projection, reflecting, like, making northern countries, Europe, so much bigger than the African continent, or that it can have big problems of borders, of how you map divisions in Israel and Palestine, for example. So my question to the panel is, what are the political questions that you come up with when it comes to mapping demographics, and what are kind of like the political and the ethical questions, and how do you go about resolving them? Thanks.
I'm going to let the United Nations have the first go at this.
Yeah. Well, I celebrated the Pakistan census, but in reality, the subnational numbers have not been released. Why? Because, indeed, the numbers dictate the number of people who will join the civil service. It dictates money distribution, public distribution, schools, etc. It's both why we need the numbers, but it's also why, indeed, they're political. So my plug for the UN, being in partnership with all the brilliant academics, is that we've been there for 40 years, and it's very, very helpful to have been in that country in a central office, working with the National Statistics Office, Minister of Planning, for 40, 50 years, because it's those sort of long-term trusted relationships that also help you gauge, well, this is what we can accomplish, let's not set the bar too high, and the timing for this particular census needs to be postponed because the election's about to happen. And if we try to do this before the election, in fact, those numbers will be very compromised. So I think that's about on-the-ground intelligence, and as Andy said, long-standing and close engagement with people in government. But let me say one more thing, is I think that the future, the answer is we've got to build great universities and support good universities in every country of the world so that the next generation coming up in that country can not only use but generate those types of data, and non-governmental civil society can also own them, advocate, and call people to account. It's got to be local. But yeah, I'll stop there. Thank you.
Does anyone else want to add?
No, I would agree. We've experienced the full force of the political challenges in producing new numbers for Afghanistan, and that those numbers that we produce can be very different, unsurprisingly, at subnational scales from a projection from 1979 in a straight line, and that ultimately affects the number of representatives in Parliament. It affects the amount of money people are getting given. So there's real challenges. And the next stage is communicating these new numbers to a population without starting a civil war. The population numbers are incredibly political and important.
And even at home, I believe, every census is contested. Yeah, please.
Thank you. This is Carolina Danovaro. I'm with the World Health Organization in immunization. My question is, what do you see being the role of more routinely collected data in helping out, and how are you having that dialogue with the countries? For example, routine data for immunization, or routine data that's being collected on outbreaks, etc. And what can we do? Where I see it, what would be your advice for us to help with this dialogue with countries? Thank you.
I can see Garnet writing. Can I?
I mean, I think this is where the engagement is very important. If we know that these kind of data are being routinely collected and can integrate those into the modeling to guide so in the data sets that Edson produces, we identify areas where we're very uncertain about those estimates. Routine data can come in to start to fill those gaps, to reduce our uncertainty. We can start to adapt the methods to those kind of approaches. That kind of data it's still vital. We're not aiming to build something that replaces that data, but it's a tool really that can help guide where do we need better data, where do we need to improve our data collection to understand better what's going on in the country, and fill some of those gaps that we have at the moment in very uncertain areas.
Okay, so we know that countries collect mostly aerial data on vaccination coverage, for example. So, but we know that for the purpose of producing high-resolution maps of vaccination coverage, point reference data, for example, which are available from surveys, do better than aerial data. So I think there is a need for countries to invest more in collecting spatially detailed data, because with those data we can obtain improved estimates of vaccination coverage, for example.
Yeah, and I was just going to add on the routine data. I think seeing the potential here of what it can do is really valuable, and being able to apply that to the routine data, not necessarily in a statistical sense, but just thinking about it is, how can this routine data be made more freely available and easily accessible to more partners, or in a more open data format, or more accessible for interoperability, really?
I'm giving all our followers on Twitter and the people who are watching the live feed a heads up that I'm going to take the next question in a moment from you. So send in your questions quickly. In the meantime, I'll just let Zoe finish up on this one.
I think the routine data collection is undergoing somewhat of a revolution of its own, and it is not unrelated to GIS. I mean, the district health information systems that are now becoming much, much better. These are particularly good for maternity, because apart from vaccinations, births are routinely counted, and they're putting them into these new district health information systems, and there is quite a level of excitement around that, and GIS skills are becoming, more prevalent in very many countries, and I think the engagement is through that excitement, really. We've been trying to engage through the district health information system academies, because you get all these local geeks who, I think you have to engage with the people that actually use those data and collect them and put them into their own systems, and I think it's really coming up now. I think it's got a future, this kind of development, and I think those, apart from the spatially reference data from surveys, which is still important, I think this basic data is going to become a big part of our bread and butter, analysis tools in the future,
Okay, I understand there's nothing from Twitter, so they're tweeting, but they're not asking questions. So I'm going to have a quick question for the panel about what lessons do you think there are from all of this amazing innovation that we're carrying on to measure things in the global south for the global north. So Andy showed us those lovely maps and things for the UK, but we're struggling at the moment to understand if, are we going to have a paper census? Is it all going to be online? What lessons are there from the innovation that we're doing in the global south for the global north?
I'll just start with an example from South Korea that's very interesting. So we saw an example recently where they do unbelievable level of integrated mapping, and they were showing that they've just launched something to try and start new businesses in Seoul. And what they enables you to do is look at a given map and say, okay, well, what's the demand for Indian food in that neighborhood, and what time do people go out at night, and how much parking is there, et cetera, and take those types of data to then the bank to get the prospect and investment initial money to start your restaurant in that neighborhood. So they just launched it, and they don't yet have feedback on how useful these kind of new data packages are to the ultimate success of the business, but the banking system seems to be optimistic that these kinds of data are in fact going to make smarter investments. And I looked at that, I thought, wow, it would be interesting to think of doing that in a bigger part of the world, but yeah.
Many of the examples I've shown, we've had interest from the Office of National Statistics, from the Netherlands Bureau of Statistics. I've been to present there. There's certainly a lot of interest in the types of analysis that can be done from mobile phones. There is an interest in the way we are integrating different data sets. So in the Office of National Statistics, it seems there are quite some siloed groups who cannot access data between groups. I don't know if this is true. Get my colleagues. So they're interested in ways to disaggregate data that they cannot access from their colleagues. And particularly as budgets get cut, as they're looking for efficiencies, these kinds of approaches, there does seem to be interest. It's coming full circle almost. There's being forced to develop them for those areas which have no prospect of collecting them, but people are looking south and seeing that.
Great.
So apart from those practical hiccups that you mentioned, I think one of the big lessons that we can take away is to think about problems in a different way. So there's questions that need to be answered, and rather than looking to those traditional routine data sources, as somebody said, it is looking at alternative ways to think about a problem. And for example, ONS has set up a data science campus in Newport, specifically to look at these problems in a very different way. And that's, I think, a really big lesson.
Final word.
I think I'm very glad you asked that question, because I think one of the important things about the SDGs is that it's about every country. So reports that I've written with Andy, like State of the World's Midwifery, has just been on 70 low-income countries, but the next one we do will be the whole world. And maternal mortality is something that can turn back very quickly. You can get countries that aren't investing very well, that are apparently rich countries, and the maternal mortality rate can go the opposite way. We need to be monitoring all countries. And there are differences, but actually sometimes there's not very much data in rich countries that we need to be looking at. Yeah.
Thank you. Gosh, a fascinating evening. And on that point, I'm going to close the panel and invite everyone to carry on the discussion upstairs with a glass of wine. I'm just minded that actually we are starting to see changes in the rate of improvement of life expectancy across much of Europe and North America. And indeed, rises in maternal mortality have been in the press in the last few weeks in the UK. So we do need this kind of reporting. So I just want to thank all the panel members and thank you for your amazing work. Thank you.